Country music star Toby Keith has been battling stomach cancer since late last year. In a social media post, he said he had surgery followed by chemo and radiation and has been, quote, recovering well. Right now, the Red Solo Cup crooner said he just needs time to breathe. His foundation has assisted children with cancer since 2006. Dr. Niraj Gusani, the chief of surgical oncology at Baptist MD Anderson Cancer Center, joins me now on the morning show. Good morning.
Good morning.
So I understand that stomach cancer is the fifth most common and third deadliest cancer globally. Now, we don't know the staging about Toby Keith's cancer, but we can talk about the disease generally. If it's diagnosed and treated before it spreads outside the stomach, the 5-year survival rate is pretty encouraging.
That's right. You know, worldwide, this is one of the most deadly cancers. Over 750,000 people die every year. In the United States, about 26,000 people are diagnosed with stomach cancer every single year, and over 11,000 die. And so it can be a very aggressive cancer and sometimes can be hard to detect. When we do find it early, it often has very good potential outcomes, and we can do surgery to remove the tumors, or a combination of surgery and chemotherapy or targeted drugs to get rid of the cancer. At later stages, we have other options as well, including radiation, combinations of surgery, chemotherapy, and radiation, which can prolong survival as well.
So what are some of the signs, the signals that you may have a big problem?
Yeah, so with a lot of GI tract cancers, it can be difficult to discern whether you have a cancer or just something more run-of-the-mill like ulcers or heartburn or so on. For stomach cancer, it's very similar. You have to listen to your body. If you feel full fast, if you're having troubles eating, persistent nausea, vomiting, pain in the upper abdomen, if you're having weight loss that's unexplained, or if you become anemic, have a low blood count, and for unknown reasons, or blood in your stool, that can cause you to be tired. Those may be signs you should see a doctor and consider getting evaluated. Doctors can do different tests, including an endoscopy, where they look down the throat and can look for these things such as cancers or hopefully other more mundane problems that cause these symptoms.
Yeah, I was going to ask you about that, because sometimes people may say, you know what, I just think I'm having a gastrointestinal problem, and sometimes it may even be misdiagnosed.
Yeah, that's exactly right. So again, you have to listen to your body. Anything that persists, that doesn't get better with treatments, should warrant attention. As we all get older, we should start, unfortunately, thinking about cancer as a possibility, because cancer is a disease mostly of older people. And so the number one risk factor for developing stomach cancer in the United States is actually advanced age.
Mm. Aside from advanced age, is it something that may be brought on by diet, something that is hereditary?
Yes, it can be both. Thankfully, most cases are not hereditary, but there are certain syndromes where people have a predilection to developing stomach cancer. And in those cases, we can screen the whole family and try to detect these things early. In most cases, though, it's simply bad luck, but can be brought on by things such as obesity, smoking, and old age. Diet issues such as eating a lot of smoked or salted fish and meats, especially common in East Asian countries where stomach cancer is rampant, and things like persistent ulcers in the stomach and bacteria which cause these ulcers are other risk factors for stomach cancer.
You know, Dr. Gusani, one of the things is when you have somebody who's as high profile or as famous as Toby Keith, who comes forward with an issue like stomach cancer, it opens some eyes and hopefully saves some lives. Appreciate your time and, you know, enlightening some people about the issue of stomach cancer. Appreciate you.
Thank you. Very happy to be here.